Welcome to The Explainer. Today we're unpacking what is arguably the single greatest supply chain challenge in all of human history. We're going to demystify India's COVID-19 vaccine blueprint, breaking down exactly how a nation even begins to coordinate an operation of this mind-boggling magnitude.
Okay, let's kick things off with some truly impossible math. 1.36 billion, that was the total population of India needing vaccination. Trying to reach that many people, spread across incredibly diverse geographies and climates, all without the entire healthcare system completely collapsing, it's a logistical puzzle of epic proportions. But the math gets even more complex. Contrast that massive domestic population with this figure right here, 200 million. Now, these are the doses promised to the Global South through the COVAX AMC initiative. So India wasn't just trying to vaccinate itself, it was simultaneously serving as the pharmacy for low- and middle-income countries all around the world. And to get those millions of vaccines safely into people's arms, you need an unfathomable physical infrastructure. Specifically, you need 28,934 cold chain points. That is the exact number of localized, strictly temperature-controlled facilities required to keep this massive operation running without spoiling a single life-saving dose.
So how did they actually pull it off? Well, here's our roadmap. We'll start with the billion-person logistical puzzle, look at vaccines for the Global South, map out the physical supply chain, navigate the cold chain, and then wrap up with COWIN, the tech backbone.
All right, part one, a billion-person logistical puzzle.
To really understand the sheer scale we're talking about, just wrap your head around this initial target. They had to reach 300 million people in just 8 months. And since everyone needs 2 shots, that's 600 million doses. Now, you literally can't just open the floodgates for 300 million people on day one, right? To stop the supply chain from just completely buckling under the pressure, authorities used a phased priority approach. They started with healthcare and frontline workers, then moved to folks over 50, and finally those under 50 with specific comorbidities. It was an absolutely essential strategy to just maintain some semblance of order.
Moving right along to part 2, vaccines for the Global South.
Now, having a solid plan is great, but you still need the actual physical vials. And that brings us to the absolute powerhouse behind the production, the Serum Institute of India, or SII. They just so happen to be the world's largest vaccine manufacturer by volume. Their role was critical here, stepping up to produce candidate vaccines licensed from AstraZeneca and Novavax. They were quite literally fueling the global fight against the virus.
But here's the kicker. How do you ensure that poorer nations can actually afford this life-saving science? Well, the cost was capped at a maximum of just $3 per dose. This unbelievable price point was backed by $300 million in at-risk funding from the Gates Foundation and Gavi. That upfront capital was a total game-changer. It allowed the Serum Institute to ramp up manufacturing instantly, ultimately securing those 200 million equitable doses for 92 different low- and middle-income countries.
Which brings us to part 3, the physical supply chain.
Okay, so the vaccines are manufactured, but now they actually have to move across the vastness of the entire country. It is essentially an invisible highway. A dose leaves the manufacturer via air transport, kept strictly between 2 to 8 degrees Celsius. From there, it touches down at one of the regional stores, gets loaded into insulated vans for the district stores, disperses to over 25,000 local health centers, and is finally carried in passive ice boxes to the most remote sub-centers. It's like a massive high-stakes relay race.
Next up, part 4, navigating the cold chain.
And if you drop the baton in that relay race, well, you ruin the vaccine. That makes strict temperature control incredibly fragile. Traditionally, we've relied really heavily on those strict 2 to 8 degree temperatures and highly trained human handlers. But the future? It offers some wild innovations. We're talking about using compounds like pullulan and trehalose to create dry powder vaccines that stay stable at up to 90 degrees Celsius. No way, right? Combine that with uncrewed aerial vehicles, drones, for remote drops, and we might soon bypass the clunky traditional icebox altogether. But right now, traditional physical infrastructure is totally useless without properly trained human handlers. And this reveals a pretty huge bottleneck in the system. Studies showed that only about 57.6% of cold chain handlers could actually correctly read a thermometer. Worse, only 11.6% knew how to conduct a shake test to check for freezing damage, and just over 60% completed regular equipment defrosting. As is so often the case, human error is the weakest link in any logistical chain.
So that begs a massive logistical question.
If human error is such a major factor, and the physical chain is this delicate, how on earth do you track 1.36 billion moving parts without the whole system falling apart?
And that leads us perfectly into Part 5, Co-Win, the tech backbone. To orchestrate this sprawling, chaotic operation, you absolutely need a single source of truth. Enter the Co-Win registration portal. Designed for a billion-plus scale, it was built specifically to be inclusive. It offered blended access, meaning, yes, you could seamlessly book online using your mobile phone, but it also heavily supported offline walk-ins and assisted registrations for those who needed it.
Now, don't mistake Co-Win for just a glorified appointment book, because underneath it runs the Electronic Vaccine Intelligence Network, or EVIN. Think of EVIN as the system's digital nervous system. It provides real-time tracking of both inventory, stock, and temperature across all 28,934 of those cold chain points we talked about earlier. It is quite literally the invisible shield protecting the vaccine's integrity.
But you know what made Co-Win truly revolutionary? Its open API architecture. It wasn't just some closed-off loop. Registration APIs allowed third-party consumer apps to help citizens find slots and schedule appointments. Meanwhile, facility APIs let hospitals quickly record data and report any adverse effects. And certification APIs generated universally authenticable digital passports that travel and office portals could instantly verify. It was this highly dynamic, open ecosystem serving citizens, hospitals, and verifiers all at the exact same time.
So, as we wrap up this explainer, we really have to step back and look at the big picture. How does an infrastructure like this prepare the world for the next global health crisis? Because this unprecedented fusion of mega manufacturing, insanely complex physical logistics, and brilliant digital APIs hasn't just solved the puzzle for today. It sets a remarkable precedent for our entire global future. Really think about that as you consider how the world is going to respond the next time a crisis of this scale emerges. Thanks so much for exploring with me, and hey, keep asking the big questions.